So I finished reading a bit of Quran and now I'm on to doing some pre-reading for today and today's session in the morning, which is respiratory and ENT stuff for children. And I just realized there's about 6 resources they put on the the online learning place. So I've got an hour to do it, so I should be able to do it.
No, Tosh, you ran on your vlog today. I've got a night shift today and there's nothing to do, so I just played hide and seek.
Yeah, I'll do my best accent, lad, yeah? I'll do Liverpool one. Mane's the best player in the world. I'm being serious, Chris. Why are you laughing? Yeah, of course.
Yeah, just stop speaking.
Newcastle accent. Mate, my lunch is proper tasty, like.
Is that it?
What? Bro, I'm from Newcastle. That's the best Newcastle accent ever.
What have you got?
Go on, do you a Newcastle accent, Moose?
Yeah, sadly, I don't wanna lose brain cells. What? Fuck, man. Learn bad. Oh, this one. What do you mean? What do you mean? Stretch, man.
Why are you covering there? You're covering there, bro.
You can see the mirror. I don't need to see that. What are you on about?
Yeah, I'm from Wales.
Listen to that.
In Wales, we have to cover the sun for our drivers. Because in Wales, we don't get any sun. So when it does get sun, we have to cover the sun.
Then the sun will go there, innit? What about gravity?
Gravity, yeah?
Sorry, gravity parity. Get out of here.
So I just took a history and examination from a patient who had asthma. This was so good in terms of like actual good learning. I was in the clinic and then I got to ask the questions and then I got feedback from the doctor as well. I also got to examine a child. So I've only done examinations on adults. I've never really examined a child, so there's sort of slight little differences. For example, I learned from a doctor that in contrast to an adult, when you examine them, normally you say, okay, is it okay if I do this? Is it okay if I do that? Depending on the age of the child, it's probably more appropriate just to say, okay, I'm just gonna do this. I'm just gonna listen to your chest now, just because it's easier for the child as well, for the examination. We went through sort of the treatment as well for the child. And I got to do an otoscopy as well, so that I could sign that skill off as well. Now I'm going to do some reading on asthma. I'm going to go through some cases, go through the treatment, management, diagnosis, all of that with Awais. And the doctor recommended that the child would get a skin prick test to test for different allergies to pollens and different type of allergies, because he had the atopic triad of asthma, allergic rhinitis, so hay fever, also eczema as well. And the child was sort of, I could see he was a bit scared. He thought it was going to harm him. He's just a bit scared of the idea of a skin prick test. I also said, oh yeah, don't worry, it doesn't hurt too much, along with the doctor as well, just to sort of encourage him to do that, because that would have helped the doctor in their sort of management of that patient.
I just did a 1-hour history and examination. Basically, there wasn't actually much. Sometimes you do find that like, you go in and you're like thinking, oh, all these respiratory symptoms, let's ask them all. But then they just don't have them. It was an 11-year-old boy and he had shortness of breath. But yeah, as I said, like we were thinking it might be asthma, so we asked like cough and all that sort of stuff, but there was literally nothing. The doctor was like, yeah, it doesn't really sound very respiratory like, so it might be something to do with his heart. Basically, when he was a baby, they noticed he had like a little murmur, so obviously they checked that out and they found that his aortic valve, which normally has like 3 little parts to it, he has a bicuspid aortic valve, which is like a heart defect, and they're thinking that might affect his circulation.
So did you do the examination on him?
Yeah.
Any findings?
No. He didn't have a rest problem.
So why are you wasting my time then?
You're right, you know. But I looked at his ear and I don't know why.
You looked at his ear?
I looked at his ear.
You just did this?
I just literally went like that.
I'm just going to look at your ear, yeah? Then we learnt about Dextapens, so they're basically the same as EpiPens. They're used to administer adrenaline in order to prevent an anaphylactic shock from progressing. These pens we're using right now, they're just training pens. They don't contain any adrenaline or a needle in. They're just used to give to children to allow them to get more comfortable with the pen, so that they're not scared to use it on themselves if they ever need to use it.
Do that wasted sound effect now.
And then after that, we went over to North Tees, where we were taught about administering fluids into children using 0.9% sodium chloride and learning about maintenance fluids and resuscitation fluids for children. We also learned about the postnatal examination, which was very cute. And after the teaching, I prepared for my first late shift, which was going to be from 5 to 9 p.m.
I'm a bit nervous, I can't lie.
I was on a children's ward, and I got there and I basically asked, is there any patients or any jobs doctors are doing that I could shadow and learn from? And they basically said, nah. And I was like, sheesh, here we go again. They said go to this other ward, and I've been told that before. And then nothing ever came of it, as in I didn't see any more patients there. But this time, there's something about Friday evening, man. I think because there's no school, the parents are able to bring their kids in, so I saw quite a bit of stuff. First patient, there was a worry of testicular torsion, but actually it was just inflammation of the epididymis. So I got to see the doctor, the consultant, actually examine the testicles of a child. That was quite cool as well. Second patient was a young lad who had been experiencing bloody bouts of diarrhea. I saw the doctor basically examine the anus. What the doctor thought there was eggs around the anus, so pointing towards threadworm. So he decided to treat for that because he said even if it wasn't threadworm, then there's no harm basically in the treatment. There's no sort of major side effects. The doctor actually said he's probably got constipation. Despite the fact that he's been describing he's got diarrhea, he said it's weird, it's like probably the hard bit of feces that's causing the diarrhea sort of. So it's a bit weird. But he gave also the patient some sachets of laxatives as well, and hoped to sort of make the hard bits of poo a bit softer, so he doesn't experience the bleeding. And I saw the bleeding as well on the picture. The mother had taken a picture of it, and there's quite a bit of blood basically from that. And then another patient had HSP. Basically it's sort of a inflammation of the vascular systems, like the blood vessels, and it causes these sort of like little rashes to come up on the skin because of inflammation of the blood vessels, and it's non-blanching as well, so it's quite similar to meningococcal septicemia, which presents similarly in that there's non-blanching purpura sort of skin marks, lesions. But the difference is meningococcal septicemia is a lot more severe. Normally it's after sepsis, and they have the meningism, so like neck stiffness, photophobia, and that's like an emergency. Whereas this HSP is not an emergency, and also it normally comes after 2 weeks after or a week after a viral infection. And he presented with these painful rashes on his legs and his ankles, and it caused a bit of swelling as well, so a bit of edema you could see, and he's struggling to walk actually, this little boy. So I got to take a history from this guy. Shout out to the F2 man. Honestly, if you're ever on a ward and you're thinking, your confidence is a bit low, it's hard to like ask consultants or registrars, senior people if you can shadow them because they're just so busy, just find yourself an F1 or F2, bro. These people, to medical students, F1, F2s, yeah, beautiful. They're hands down the best for medical students, because these F2 and F1s can like relate more to medical students as well because they're a bit more junior, but they are so good. So she basically let me take the history for this young boy with HSP, and also we did a urine dipstick as well, so I got to do a sign off for that, and also the history as well, so really happy about that. But anyways, getting a bit late, so I'm gonna probably get home. I'm gonna check if there's any buses flying about, but probably it's looking like a taxi. I'm so happy, alhamdulillah, like bro, because my friend yesterday, he went on the same sort of late shift, 5 to 9. He said he didn't see any patients basically, but alhamdulillah, like I was able to see these patients and take a history and get something signed off. I got something out of it as well, so really happy as well. So yeah, cool, peace. Takeaway time, baby! It's takeaway time, baby! That's kind of handsome though.
That's you.
This is happiness, bro. I came back tired from my late shift, and I come back to pizza, a movie, my best friends, and my Rubicon. Oh my gosh, alhamdulillah.